are as healthy as we want to be. And you know, it's like anything else, catching something early is the best way to save a life. So with that, Dr. Martin, we welcome you here to Community Links today.
Thank you. Thank you, everybody, for being here today. As Vanessa said, I'm Dr. Sandy Martin, and I'm a radiologist at Coosa Valley Medical Center. I've had the pleasure of working at Coosa Valley for a little over 10 years. And I'm very happy to be here with you all today to tell you about an exam that we offer in the radiology department called a lung cancer screening CT, or you might know a CT as a CAT scan. Lung cancer is a leading cause of cancer deaths in both men and women. In 2014, there were over 400 deaths per day due to lung cancer, so it's a very serious issue. And I'm sure everybody in here knows that the major risk factor for developing lung cancer is smoking. And through studies, they have found that people in this high-risk category, the smokers, that if they enter into this lung cancer screening CT program, we can decrease lung cancer deaths by over 20%. Now, this is not a new CT scan that they've devised. They came up with this plan back in 2012 for this type of chest CT, but it's only been in recent years, the past 2 to 3 years, that the major insurance companies and Medicare and Medicaid have been paying for it in full with no copayment by the patient. You know, I think they've realized that it's more cost effective and less expensive for them to find these cancers early when they can be cured with a simple surgical procedure, instead of finding them when they're in a later stage and they require more intense surgeries, longer hospital stays, radiation, and chemotherapy. Now, who qualifies for this lung cancer screening CT? It's people between the ages of 55 and 80 with at least a 30-pack year history of smoking. So that's a pack a day for 30 years or 2 packs a day for 15 years. However, it calculates for that individual, and they cannot have stopped smoking more than 15 years ago. So they've still smoked within the past 15 years. Now, you or somebody you know may fall into this category, and you might be wondering, how do I get one of these lung cancer screening CTs? Well, we do need an order from a doctor. We all benefit from having a primary health care physician help us oversee our health and our health choices, especially as complicated as health care and the choices that are available are today. That would be the person that discusses with you the risks and the benefits of entering into this screening program. And it's also the person who would receive your report and communicate that report to you and help you navigate the next step if a next step is needed because of something that we have found. It's a lot like screening mammography in that the interpretation of your scan will generate a score, and that score corresponds to a plan for you. And a score of 0 means we need to do a little bit more. For some reason, that chest CT wasn't everything we needed right then. A 1 is that we have found no problems. A 2 is that we found some things, but we know that they're benign, not cancerous, and nothing to worry about. A 3 is we found something, but it's very likely to be benign, and we can just bring you back sooner than the usual 12-month follow-up and look at it again and make sure it's not something growing that would be worrisome. And a 4 would mean that additional testing is needed or maybe a referral to a surgeon. Now, some of you might be thinking, well, I get a chest x-ray when I go see my primary care physician. Isn't that enough of a screening? Well, in this high-risk population, when we're trying to find these cancers early, when they're just the size of a grain of rice or the size of the tip of your fingernail, on a chest x-ray, that can be hidden behind normal structures. Chest x-rays are great for a lot of other diseases and a lot of other reasons, but in this situation, they're just not sensitive enough. What a chest x-ray does is it averages all the tissues within your chest into one image. That's the reason things can hide behind normal structures. A CAT scan takes several chest x-rays when you're lying in the tube, and the computer compiles them into an image. That image looks like a slice through your chest. So we can see directly inside your chest and see items for what they really are and find those very early lung cancers. Now, you have probably heard, and rightly so, that radiation can be a problem to the body, but this screening program uses the lowest dose of radiation possible. The name of the CT is actually a low-dose screening CT. A typical CAT scan of the chest, when a person is having symptoms and they get the dye and it's a full chest CT, not the screening type, that delivers 7 milligray of radiation to the body. The screening chest CT delivers only 3, so that's less than half of a usual chest CT. So now I'm going to teach everybody to be a radiologist. Just don't tell everyone how easy it is, okay? So what I teach the medical students and the residents is that God loves symmetry, and symmetry is our friend. So here's a normal chest x-ray, and the right lung looks like the left lung, and here's the heart in the middle. So this person has normal lungs and no problems. Now here's a chest x-ray showing a problem. You can see that over here on the right side is something that's not matched on the left side. It looks like a white ball, and maybe there's another little white ball here too. This is a lung cancer, and this is later than when we want to find it. This one is probably already involving some of the important structures in the middle of the chest. Here's another example of how we can see lung cancer on a chest x-ray. Here again is a normal left lung that is not matched over here. We have something over here that isn't over here. When it's on both sides, it's usually normal anatomy and nothing to worry about. So again, it has that rounded ball-like appearance. And here it is on a CAT scan. So this is a slice through the chest. This is the person's back. They're laying on the table. So this is their front. And over here on the right is a rounded, solid, white ball-type structure, or what we call a mass. And on the margins of the mass, it has these little star-shaped areas, or spicules. We call it spiculated. Spiculated is usually a term that means something is aggressive. It's actually reaching out into the normal lung around the mass. That's one way that they grow. Here's another example of a different lung cancer that we saw on a chest x-ray first, and then here's the CAT scan. And again, it has kind of an angry or spiculated stellate appearance where it's reaching into the lung around it. And over here, you have the normal left lung, so definitely an asymmetry there. Here's another example of a lung cancer that we saw on a chest x-ray. Here's the CT. It's larger than when we want to find them. Here's that mass, and I'm sure all y'all could have picked that out. And this one's, it's so aggressive that it's outgrowing its blood supply. That's why it has a different gray appearance here than here. And it's already beginning to involve the lining of the lung. And the little yellow arrowhead is pointing to a small lymph node in the middle of the chest that's bigger than it should be. So it looks like here that we already have some lymph node involvement. And this lymph node looks suspicious to me as well. Here's one that showed up on a chest x-ray. It's quite large. And I'm showing this example to show you that also at Coosa Valley Medical Center, we're able to biopsy those in our department when it's needed. So here's the patient laying in the CAT scan machine on their back. And I did a biopsy of this one. These are skin markers on a sticker on the skin surface. That's how we plan where we're going to take the biopsy. And the next image shows the biopsy needle coming into the mass. And here where you see that shadowing, that's where we're taking the biopsies. And this patient was awake and comfortable during the whole procedure. We do numb up the skin surface because that can be a little bit painful, but you actually don't have nerve fibers inside your organs, so he couldn't feel it when we were taking the biopsy. He did very well. Now, to be in the screening CT program, you can't have any symptoms of lung cancer. These CTs are done before any symptoms, again, when we're trying to pick it up quite early. Lung cancer can grow for a while without causing symptoms. You know, with breast cancer, sometimes you can feel a mass occur, and you can also feel when it's growing. But deep inside your chest, you can't feel that. So some of the symptoms of lung cancer might be a cough that just won't go away, or coughing up blood, or losing weight for no reason, or having no energy, increased fatigue. Now, in this case, this patient came to the emergency room because they had symptoms of what's going on over here, and that's pneumonia. But over here on the chest x-ray, we found a lung cancer as well. It just probably wasn't causing any symptoms yet. And here's a CAT scan on that same patient. So over here is the pneumonia. Notice it doesn't have that solid ball type look like a mass, and over here's the cancer with the spiculated margins. And here's an unfortunate case where it had already spread distant to other organs. And that's what you call a stage 4 cancer. It had started over here in the right lung, but you can tell by this big mass in the center of the chest, it's involving the lymph nodes. And unfortunately for this patient, it has gone to the liver. So this is a slice through the upper abdomen. Again, the picture is made by the computer from multiple x-rays that it computes together. And here are the kidneys. Here's the spine. Here's the spleen and the stomach. All of this is the liver that's on the right side of your body, and it should all be the same shade of gray. But here you see one of those rounded areas of a mass, and that's the tumor from the lung had moved to the liver. Now, on a lighter note, this is when we want to find them. This is more like the size of a grain of rice. So right here on a screening CT, we see this tiny little nodule. This one actually did not turn out to be a cancer. There are other reasons to get these tiny nodules. This is one we followed up. It never grew, so it was not something to worry about. This one did, however. Now, you might be saying, Dr. Martin, there's lots of white dots around there. Why are you picking out that one as the problem? Well, I can tell that all of these are blood vessels. I can tell by the density in them, and I can tell by how they branch. Out here, if you're able to see multiple slices in a row, you can see that this is there and then gone, so it's not branching like a blood vessel. So this was a nodule. We followed it up earlier than the normal 12 months when you would come back for your next screening CAT scan, and it was growing. So this one was removed, and this patient was cured without any radiation or chemotherapy needed. This is an example of something that we might find that looks like a mass, but it's benign, not cancer. This is something called a hamartoma. And we know that by some of the features of it on the CAT scan. And you'll also notice the margins of it are real smooth. We don't have any of those spicules stretching into the lung around it, which we had talked about earlier was a sign of an aggressive lesion. So this was a hamartoma. It didn't need any further follow-up. This is one that was picked up on a screening chest CT, and it was hidden by the rib out here on a chest x-ray. It does have those spiculated margins, but it's very small. Nothing like those larger ones we saw earlier. This is an image of the same lesion from a PET scan. Some of you might have heard of PET scans. It stands for positron emission tomography, and it's where we tag sugar with a radionuclide, and it's taken up in the tissues that grow the fastest, and cancer by far would be the tissue that grows the quickest and the fastest. So we do a lot of PET scans at Coosa Valley Medical Center on cancer follow-up patients, and we also use it as one of, to help us in diagnosis of some of these lesions. So this one was very bright, so we knew that it was cancer, and then this is just an image showing the biopsy of the lesion. And then it showed cancer, and the patient had it resected, and they did very well. So you might be wondering what it's like to have one of these. You know, how do you prepare? How long does it take? And you actually don't even have to put on a hospital gown. As long as there's no metal on whatever shirt you wear, you can wear your shirt in there while you're having it. And there's no dye, so there's no IV, there's no checking the function of your kidneys. It's quick. By the time you are at the door of the CT room, it's probably about 10 minutes until you leave, and most of that time is just talking to the technologist and getting on the table. The actual scanning takes about 30 seconds. You take in one big deep breath and hold it, and before you know it, you're done. And some of you might have been told before other tests not to eat breakfast or not eat after 8. You can eat like normal around the time of this test. That doesn't affect this at all. So we are hoping that you all can help us get the word out in the Sylacauga community, because we sure would like to save a lot of people some suffering that could occur when the diagnosis is made late. Let's make these diagnoses early. And I'm happy to take any questions, and I'll do my best to answer them.
All right, we'll start taking some questions. Dr. Martin, I actually have one. I'll kind of get us jump started. So run through again. I heard you say the symptoms once you, you're into it and probably have lung cancer, but what are the symptoms that somebody might have today that would make them want to pick up the phone and call and say, let's just do a screening? Is there, or just your age alone?
Well, I will stress that if you have symptoms, then you don't qualify for the screening program.
Okay.
So before you feel bad, you need to think about having this done if you fit in that category. Now, a sign that you might, or some signs that you might have a problem and might need to talk to your doctor would be that cough that just doesn't go away. And we've all had some coughs that linger because of a virus, but you know yourself and your body, and after about a month, or maybe 3 weeks, you really shouldn't still have that cough. So that would be one time to definitely call your doctor. Another is if you're ever coughing up blood. That's a sign you need to get seen about. And then the losing weight for no reason and fatigue. These are things to think of or look for.
All right, okay. Well, let's start right back here with a question. I'll try to get to you so we can all hear.
Yes, I was going to ask about why I hear that secondhand smoke is worse than smoking. I might rather smoke, instead of sit by somebody that's smoking.
I don't know that it's worse. I think one reason they say it's worse is because that person assumes that they're not going to have any problems from smoke if they've never actually smoked themselves. So that's one way it could be worse, because they could have lived with somebody with a 30-pack year history, and I agree with you, then they need to enter the screening program. But it's still probably more toxic to the body if you're the one taking it in.
Miss Alex?
I would more or less make a statement rather than a question. They talk about secondhand smoke. My sister, this particular Friday evening, Russell Hospital called me. Said you need to get down here. Said we got ethylene down here. We'd give her 10 days to live. She did not smoke. She lived with a chain smoker. And she had died of lung cancer.
That's a great point.
It can definitely be toxic to the body, just like you're the one smoking it.
Okay. Other questions? Anybody else have a question? Okay.
Is there any way you can do to prevent this from getting in?
Well, one reason that they say you have to have smoked within the past 15 years is because quitting smoking really benefits you. That's great. And we want to make that part of our screening program, is that the technology talk to the patients as they come in and find out, is this person still actively smoking? And if they are, how can we help them to give it up? A lot of people started smoking before we all knew that there was a problem with it, and when it just seemed like a part of the culture. And I think back then they were even encouraging it with marketing and billboards. And
Dr. Martin, a good question along that line is, I see so many young people that continue to smoke. Are you guys doing anything actively to educate, say on the high school level, maybe a health fair or something to get that across to those people?
I'll actually take that one. You may or may not know that Coosa Valley goes into Silicaca High School for, I don't know how many years we've been doing that, for quite some time. And part of that is a lot of different healthy tips about, everything from healthy eating to, various things that we try to teach. But one of those is definitely about smoking, and we actually have these lungs that you can look at, and they look terrible, and we try to have someone there that can help teach and educate and encourage our young people to kind of show them what the future looks like. Because when we're really, really young, we're not thinking about that, right? But when you begin to get older, you begin to think about all those things and what it really does to you and how it really affects you. So we are trying to do that. Well, it's been great, and so it has expanded into our county school system the last couple of years. So now, just last week, we were at Federal, and in a couple of weeks we'll be at Comer, and a few more weeks we'll be at Silicaca. So we are reaching out. And then our team members, a lot of them are going into the individual classrooms, even to the younger grades, and teaching all kind of health issues, but taking care of our lungs and smoking and those sort of things are right at the top of that list. So hopefully we're making somewhat of a difference in teaching and educating our young people and community through those efforts.
Does your primary doctor order this test? Does your primary doctor?
yes.
But a lot of times when we're meeting with our primary doctors, they will just, hey, I'm concerned, or I now know I can get this, or I've reached that age, or hey, you know what, I just feel better. If I got this, I think I'd have a peace of mind. Guys, a peace of mind, my grandmother used to say this, a peace of mind is worth a lot, but really, it really is, right? So maybe it's a peace of mind that you need, but, talk to them, encourage them. Maybe they hadn't thought about that for you, but it's something that you've heard about and learned about. And now, I think one thing is, Dr. Martin indicated this, insurance was not covering it, but it does cover now, because our insurance companies are realizing, hey, let's catch it on the front end. It costs a whole lot less to take care of someone, and plus, if you take the cost out of it, it's about quality of life, and that's so much better than waiting too long. So, any other questions, or? Okay. I'll take one more over here.
We're talking about smoking, and I know some people have substituted the vaping with the smoking, and I don't know how much harm that does. Have they done research on that, or whatever they call those things?
Well, you have choices of what you can put in the vape devices, and some of them don't have toxins, but some of them do. Especially the ones that contain nicotine, that's going to be just as bad as smoking a
I know
cigarette.
there's many flavors.
Right.
All right, anything else? Well, all right, let's again give Dr. Martin a big hand for some great information. Thank you. And I'm always so thankful to know that our doctors come and serve our community for over 10 years, guys. So much to be thankful for, and she does a fabulous job. I've had some one-on-one personal, take out the professional, and I can't even tell you how awesome she is. And so again, we're so thankful. All right, Lindsay, you got a crew. We got some good door prizes.
Mr. Ferris told me to mix it.
Okay, well, Mr. Ferris said mix it, let's mix it. All right. Mr. Mueller. Denise Mueller.
Oh, that one's blank.
Billy Kleckler.
Mr. Mueller, Miss Mueller, right there in the house table. Yeah, there's you.
Joan Blocker. John Harris. Miss Linda Price. Dot Thornton. Miss Laverne Green. Sarah Shaw. Mr. John Harris.
You're welcome.
All right, guys. Well, we're so glad you're here. Hey, Jeremy, are you going to be here for a few minutes? Hey, guys, if you have other questions about the test in general, or maybe how you can get connected, got some questions you want to ask privately, Jeremy will be here. Jeremy is director of our imaging as well as our cath lab, but today we're talking more about an imaging test. So if you have some questions that you want to ask him, then feel free to do that. We're so glad to have Jeremy come to Coosa Valley, come to Sylacauga, call it home, and he was here with us before a couple of months, and so we're glad he's back, and he can help answer those questions if you have any. The first Monday in April, we'll be back, and you know, we're headed towards the end of our series. I can't believe we're headed towards summer, but we are. So be back in April, we'll be back in May, and thank you for coming and sharing this time with us. And again, we want to meet you at your point of need at Coosa Valley Medical Center, so any way we can help you get connected, please reach out to us, and we'd love to. Thank you, and have a good March.